Excellent. So welcome to the launch event of our Cambridge Mathematics of Information and Healthcare Hub, short CMIH. I'm Carola Schönlieb. I'm the co-director of the CMIH, and together with my colleagues John Aston and James Rudd will open this event and introduce you to our Math in Healthcare Hub. So starting with a few facts and figures, the CMIH is one of 4 EPSRC-funded Math in Healthcare Hubs. We started business on the 1st of September 2020, following on from a previous Math in Healthcare center that started in 2016. The core team consists of 19 investigators across the board, from mathematics, statistics, to computer science, engineering, physics, all the way to medical research and clinicians. And a team of postdocs, with 3 of them being core hub funded and several affiliated postdocs that are complementing the team. In addition to the postdocs, we also have a cohort of PhD students which have started, are starting in 2021. And they are funded by GSK and Aviva. Thanks a lot for the support. So the mission of the CMIH team is to develop novel data analysis techniques that combine mathematical and statistical rigor with latest developments, advances in artificial intelligence that really directly link to the requirements in the clinic through strong and interdisciplinary collaborations, and that focus on 3 core medical clinical areas, namely cancer, cardiovascular disease, and mental health.
And hi, everybody. I'm James Rudd. I'm the clinical lead of the center. I'm going to talk to you about the research objectives of the center. So as Carola said, the aim is lost the slides, Carola. Okay, there we go. Fantastic. Thank you. The aim is to develop some new mathematical techniques for particularly optimally acquiring imaging data. But in this iteration of the center, as opposed to the last iteration, we're also planning to integrate non-imaging data in a sensible way. The overarching aim, of course, is to improve patient care, either through improved diagnosis or improved prognostication for patients, or allocation of the appropriate treatment at the appropriate time. We aim to do this by working closely with the groups that Carola have also mentioned. And my particular focus is to bring clinicians, NHS clinicians from across the UK, but particularly within Addenbrooke's Hospital, allied to biomedical researchers, computer scientists, and all the other groups that Carola said, to make sure that we focus on clinically relevant problems. We decided on this occasion to align the areas that we're going to work in within medicine to the NIHR, the National Institute of Health Research Biomedical Research Centre, which is a £6 million operation that we have in Cambridge. And namely that includes focusing on the diagnosis of treatment in cancer, in mental health, and in cardiovascular disease, 3 of the pillars of the NIHR BRC scheme. We're also hoping to close the gap and improve the way that artificial intelligence is used within medicine. We're all aware of the enormous amount of interest and in some cases hype that this technology has brought recently. And particularly during the COVID campaign or the COVID pandemic, we've been aware of a lack of robustness of most of the algorithms and the papers that have been published in this area. And Dr. Mike Roberts will talk about that a bit later on. And finally, we're also partnering with investigators in Dundee, Professor Emily Jefferson, who's going to work with us to be able to release algorithms in a seamless fashion online. So we host a modular toolkit which can be downloaded eventually by anybody with a research interest. I'm going to hand over to Professor John Aston to outline some of the high-level maths challenges we're facing in the centre. I think.
Thanks, James. And so yeah, I'm John Aston. I'm one of the other co-directors of the centre. And I think I hope it's been clear so far that we really are focused on making sure that the best mathematics comes through to the clinic and can be used for patient care. But I think it's also very important to recognise that often the best mathematics is enhanced by really having a concrete application that drives thinking. And then in actual fact, often we need to think about new mathematical techniques and new mathematical tools to allow us to do the kinds of things that we think should be possible. So we are going to be really keen on working out how we bring together new data analysis methods to bring together the imaging data that we concentrated on in the previous centre with the imaging and non-imaging data that we want to bring together in the hub, particularly incorporating health records, genomic information, etc. So I think there's an awful lot of interesting, purely data-driven understanding of how you bring together complex, different types of data. But of course, we also know that clinical data is not nice, clean, easy to deal with. It has lots of data comes with little to no annotation and has noise and other problems such as missingness. We want to bring together supervised methods and unsupervised methods to really understand how we do that, and then also to make sure that we are taking ideas from areas such as PDEs on graphs to really help us bring together the imaging data and the non-imaging data in a sort of optimal manner. That's going to require us to put together a pipeline for understanding the whole process of gaining the data in the first place all the way through to the clinical decision making. That's a really complex, non-linear, non-convex optimization problem. And that's going to require some new thinking about how we can actually do that in a way that we have some form of mathematical guarantee. But I think one of the things that for me is the most exciting part of all of this is that bringing together statistics, applied maths, some of the PDE challenges, physics-based modeling into the data science and AI techniques is possibly one of the most exciting areas of machine learning and AI that is happening worldwide, regardless of the application area. However, I think by having a really concrete application area of healthcare technology and medical imaging and bringing together imaging and non-imaging data, we can ask and answer some really fundamental questions, understanding how you bring together physics-based modeling and AI.
So as we've discussed on the first slide, as Carola mentioned, the hub is co-directed by John and Carola, with myself as the clinical lead and a co-investigator. I'm a cardiologist in my day job and a researcher in my night and evening jobs. And it's my pleasure to work with these two world leaders in this center. Everything the oils are greased by John Stevens, who is a fantastic administrator and coordinator of the center, as well as the CCIMI, which you may be familiar with. And we have some amazing postdocs who are listed here on this slide. You can read the names for yourself, but we are really proud with the recruitment that we've been able to do over the last few months, particularly during COVID. All of them are now in post, apart from Milena, who is joining very soon from the University of Graz. But we think we have a really good range of skills and abilities from across the areas of the hub that we want to concentrate on. And you will hear from some of these postdocs over the next few hours or into tomorrow morning. We're also really grateful to have such an amazing array of industrial partners, ranging from software companies to hardware companies to insurance companies, of course, pharmaceutical companies, as well as our friends and colleagues here in Cambridge at Microsoft Research, and also the Alan Turing Institute just down the road in London. It's been a pleasure to put the grant together with them, and we really look forward to working with them on these projects. As I mentioned previously, the initial aim of the new centre is to concentrate our research efforts in 4 areas: cancer, cardiovascular disease, dementia, and then a new area for us. And we're really excited to be working with colleagues in the Judge Business School on optimizing healthcare pathways. And of course, at the moment, in fact, for the last 12 months, we've been working very hard across the center on COVID, as you might imagine, as many researchers have across the world. We've been concentrating on trying to improve the diagnosis and prognosis of patients with COVID based on their electronic healthcare record data, but particularly chest X-ray and CT findings. And you'll hear more about this in Mike's talk later on. Just for the next slide, I'm going to touch on a couple of highlights from the last center, which have recently been published. This is work that was led by Yuan Hang, who is going to be talking later on today. He's been concentrating on 2 areas within cardiovascular medicine. One on the left-hand side is within the coronary arteries, and is a really nice project where we aimed to bring together intravascular imaging. You can see in the right-hand 2 columns, VH-IVUS, virtual histology, intravascular imaging, and this is the view of the inside of a coronary artery, so arteries around the heart that supply the heart with blood. And the image has been color-coded, and the different colors represent different composition of the arterial wall, white being calcium and red being lipid core. And this work was we also brought together some engineering, some novel engineering work, which gave us plots of the wall's shear stress and tensile stress of the arteries during regular heartbeats. And Huang and colleagues listed here, including Prof. Martin Bennett, was able to show that the integration of both the imaging and the structural data was better than either of those alone at predicting outcomes for these patients. And in some related work in the aorta on the right-hand side now, again, working with Dr. Jason Tarking and Juan, we were able to show that patients with aortic aneurysms, so enlargements of the aorta within the abdomen, this is a very serious condition and can result in significant morbidity or mortality. And we showed that by using PET imaging with fluorodeoxyglucose, but also combining that with some engineering measurements to measure wall stress, again, we were able to predict better patients who are going to run into problems with an expansion of the aneurysm than either imaging technique alone. So again, relevant clinical problems, but using new engineering and maths along with the imaging to improve patient outcomes.
And similarly, following on with some of the research we did in the last center, one of the things that I think has become even more prominent, not just in healthcare imaging, but in many forms of biological imaging, is understanding that we can't talk about function without talking about shape. And so really being able to integrate understanding of geometry into our analysis has been one of the things we did. We spent time on during the last center. Here we see 2 different examples, one from bone imaging and one from brain imaging, where in actual fact, understanding the shape changes and what that has in relation to the function is actually paramount to understanding what is actually happening in the systems themselves. So you see in the bone example, where you're really understanding what the surface texture looks like and how that is related to the shape. And here is the thickness of the cortical surface, really trying to understand how that goes together. But of course, it's not simply about one set of data. It's about a set of data we need to understand where the data came from, what kind of imaging the data came from, how that imaging is then registered together so that you can look at multi-subject analysis. What information is contained in that registration? Maybe that registration data is just as important as understanding the ultimate aligned data itself. And then looking at how you might deal with population analyses and putting the statistics together, incorporating the parameters that have come from the previous parts of analysis to really understand what is going on at the population level. And then in the brain imaging example, here we're really trying to understand what the relationship is between changes in shape and changes in cortical thickness. In current work, we're looking at changes in shape and changes of connectivity and trying to understand how those 2 are linked together. these have profound implications in trying to understand diseases such as Alzheimer's and looking at other diseases where you have implications for changes in connectivity as well as changes in shape. However, it also leads to some fascinating mathematical problems where you really cannot make the usual assumptions of Euclidean spaces, where you can just do linear operations and add things and subtract things together in the normal way. You really have to understand the geometry and the space that these objects live in. And then you have to define new techniques to really understand that manifold structure, defining new types of statistics that allow you to really get a handle on this particular type of analysis. But it's the application to the fact that you have, in this case, in the brain case, a two-dimensional surface embedded in 3D, really sort of drives a new set of statistics, which the usual assumptions would just assume you have nice Euclidean-based objects.
So another really important theme in the CMIH is multimodality. And here I'm showing an example on using multimodal MRI for treatment planning for glioblastoma patients. So on the left, we investigate patient clusters with respect to survival based on multi-contrast MRI. And on the right, we develop an algorithm that can predict the reoccurrence of tumor tissue from preoperative MRI. In both of these cases, the interplay between data-driven components, where we really extract and train algorithms based on the multimodal MR data that we have, with biological models of tumor growth is super important, and is one of the things that we got really excited about when doing this research. So Chao will talk a little bit more about this in his presentation tomorrow. So James already mentioned the COVID project that has kept us really busy for the last year or so. So this is the last example that we want to show that highlights that is part of the also current highlights of the new edition of the CMIH. And so this is our what we call AIX-CovNet collaboration. And here our aim is that we want to develop an open source AI tool that combines chest imaging data, clinical and laboratory data, so very much in the realm of the CMIH of combining imaging and non-imaging data with each other to support the diagnosis, triaging and treatment planning for COVID-19 patients in hospitals in the UK, but also worldwide. So this is really a very exciting collaboration that we've put together with various hospitals in the UK, in Europe, internationally, with various other academic and industrial partners, and that we are very actively working on. And so far, one of the highlights, I would say, that has been kind of a spin-off of our algorithm development work, but a very substantial spin-off is a systematic review and an opinion piece on investigating both the demands and challenges that clinical tools, AI-based clinical tools are posing to the algorithm developers. So what are the requirements, and are they really met in doing such an algorithm development work in an emergency situation such as the current pandemic? And I think we saw some very maybe surprising results, especially in the systematic review, that really showcased the difficulty in developing something that is fit for the clinic. And so this is what we are, that's what we are aiming to do in our AIX-CovNet collaboration. So yeah, I think I don't want to say much more. So this is really, I think, finishes the overview of what is the CMIH, our Martin Healthcare Center in Cambridge, about. what are our main research, our main mathematical objectives that we want to reach, what are our main clinical medical research use cases. And I think I'm speaking for all of us that we are really excited about the new CMIH, the Mathematics of Information and Healthcare Hub, and we really look forward to working closely together over the next couple of years. And yeah, and I think in the short term, I'm really looking forward to the presentations today and tomorrow. Also looking forward to hearing more from the other Math in Healthcare hubs. And yeah, I'll finish, and the floor is open for questions and comments. Thank you very much.